Let's be honest, walking into a hospital can be a lot. The whole environment is new, the routines are different, and it's really easy to feel like you're just being swept along for the ride. But what if you had a roadmap? Well, that's exactly what this is. Your guide to navigating a hospital stay, not just as a patient, but as an active, empowered partner in your own care.
So, we're going to cover 5 key areas to help turn that uncertainty into confidence. First, we'll get our bearings with the hospital layout. Then, we'll introduce the amazing team of experts who are all there for you. We'll walk through what a typical day looks like, explore your crucial role in your own care, and finally, get you ready to go home safely.
All right, first up, the layout. A hospital can feel like a total maze, right? But just understanding the key locations is a huge first step to feeling more grounded and in control.
For a lot of people, the hospital journey kicks off right here, in the emergency department, or ED. You can basically think of it as the hospital's front door for any urgent problem. There's a whole specialized team here that works super fast to figure out what's going on, get treatment started, and decide the best next step for you.
And yeah, that front door, it never closes. The ED is open 24/7 every single day of the year. It's a promise that urgent care is always there, right when you need it.
So, once you're admitted, there's a good chance you'll land in what's called a general medicine ward. This is the main hub for most patients who don't need critical care. If you're dealing with something like a common infection or managing an ongoing illness, this is probably where your room will be. Your care will be guided by doctors called hospitalists who specialize in treating patients right there in the hospital.
Now, for patients who are the most seriously ill, there's the intensive care unit, or ICU. This is a highly specialized area with all sorts of advanced life support equipment, like breathing machines. But what really sets the ICU apart, even more than the tech, is the higher nurse-to-patient ratio. It means you get constant, close monitoring, which is absolutely essential for anyone with a critical condition.
Okay, so that covers the where. Now let's talk about the who. Because here's the thing, you're never just one doctor's patient. You have an entire team of dedicated pros all working together just for you.
Honestly, this might be the most important thing to remember during your whole stay. From the minute you get there, a whole diverse group of specialists is collaborating with one single focus: you and your recovery. You are not alone in this.
And this team includes a huge range of specialists. For example, a physical therapist, or PT, is going to help you get your strength and mobility back. An occupational therapist, an OT, focuses on the practical stuff, the skills for daily life. Your social worker is your advocate for planning a safe trip home, and a respiratory therapist is there to manage any breathing support you need. Every single one of them plays a vital part.
And believe me, the team doesn't stop there. You've got dietitians making sure your meals are right for you, pharmacists checking your medications, and financial counselors who are there to help no matter what your financial situation is. And this is super important. Professional medical interpreters are always available, and their services are completely free and confidential.
All right, now that you've met the team, let's talk about the rhythm of a hospital day. Just knowing the routine can make everything feel way more predictable and a lot less stressful.
Think of your day in the hospital as having 2 main beats. First, you've got physician rounds. That's your dedicated time with the doctor's team to talk about the big picture. And then you have the ongoing nursing care, which is that constant moment-to-moment support that's always there for you.
Okay, 7 to 10 minutes. I know that might not sound like a lot, but this time is pure focused gold. This is your chance to hear the plan for the day, check on your progress, and, most importantly, ask your questions. The key is to be ready for this visit.
Your nurse, on the other hand, is going to be a much more familiar face. During the day, they'll pop in every hour or two to check your vitals, give you meds, and help with whatever you need. Then at night, they'll space those visits out a bit, to every 2 to 4 hours, so you can actually get the rest you need to heal.
This brings us to a really vital idea. The doctors, the nurses, the therapists, they're all incredible experts. But the single most important person on your care team is you. Your voice and your participation are absolutely key to getting the best possible outcome.
So how do you step into that role? Well, here are 5 simple but seriously powerful actions you can take. Ask questions. Think of them as your superpower. Use a technique we'll talk about called Teach Back. Bring a family member or friend for support. Write things down so you don't have to remember everything. And finally, always know what meds you're taking and why. Let's zoom in on Teach Back for a second, because this is a total game changer. It's so simple. After a doctor or nurse explains something, you just say, "Okay, Just so I'm sure I've got this, you want me to, and then say it back in your own words. It is the single best way to catch misunderstandings before they turn into problems.
You know, from the very moment you're admitted, your team is already thinking about the final step, getting you home safely. So let's talk about how to make that transition as smooth as it can be.
To really take control of your health journey, you've got to start with the basics. The most fundamental question you need a clear answer to is this one. What is my diagnosis, and what does it actually mean for me? Don't even think about leaving the hospital until you feel 100% confident in that answer.
This question is all about setting a clear goal. Knowing your target discharge date and, even more importantly, the specific things you have to do to get there, like maybe walking down the hall or eating solid food, gives you a clear, actionable path forward.
Think of this one as your personal safety checklist for when you get home. Your team can give you specific warning signs or symptoms to keep an eye on. Knowing what to look for empowers you to act fast if something just doesn't feel right.
And finally, your care doesn't just stop the second you walk out the door. Make sure you leave with a specific name and a clear contact number. Knowing who to call is your safety net, and it provides so much peace of mind while you're recovering at home.
At the end of the day, it really all boils down to this. There are no silly questions. Your curiosity is one of your greatest tools. So ask away. Your team genuinely wants to help you understand. Being informed isn't just your right, it's the absolute best way to ensure a safe recovery. So, what's the one question you'll be sure to ask at your next healthcare visit?